So knee pain is a common problem that we see here in physical therapy. So I'd like to go over first the anatomy of a knee, the basic anatomy. You have first the femur, which is referred to as the thigh bone. You have your tibia and fibula, which is referred to usually as the shin area. And you have your patella, which is often referred to as the kneecap. Supporting those bones and holding them together to form the joint are supportive structures, which are the menisci, the ACL, the PCL, the MCL, and the LCL. Those all play supportive roles. They're made up of cartilage and connective tissue. And then there's the muscles around the joint, which actually move the joint. The main muscle groups are the quadriceps, which are in the front of the thigh. You have your hamstrings, which are in the back of the thigh. You have your gastrocnemius, which is a large part of the calf muscle. You have your adductors, which are in the inner thigh. And you have your IT band, which runs along the side of the thigh, connective tissue that attaches at the knee, but it's controlled by muscles up at the side of the hip. When all these structures are functioning well, it's a very stable joint. It's responsible for accepting weight and taking impact and allowing your body to pivot and twist on your knee. The knee can easily become unstable when there is an insult or injury to any of the supportive structures or muscles or bone that have to do with the joint. The joint becomes unstable when there is a torn ligament or an inflamed ligament or a muscle tear or weak muscles. Things that cause pain in the knee are usually structures that are inflamed. That can happen from slipping and falling and landing on your knee. It can happen from twisting on your knee, pivoting in sports, or just taking a sharp turn. You can also tear a muscle, have a muscle strain, and that will all cause pain at the knee. There are also indirect ways for the knee to become injured and have pain. Those things consist of osteoarthritis or rheumatoid arthritis, general wear and tear, sedentary lifestyle, poor body mechanics in which the joint is stressed improperly. Lax ligaments can also contribute. Some people are what we would refer to as double jointed, and they just have extra joint mobility. Having surgery without correct rehabilitation. Weak muscle around the joint can also contribute to stress and inflammation of the supportive structures. So how can your knee problem or pain progress? Probably the worst thing you can do is ignore the pain or the tightness that you're feeling, even if it's occasional. A lot of times we'll see people here in the clinic and they said, 6 months ago I had the mindset of it'll eventually go away or my body will heal itself. So the reality is that the body does want to heal itself. A lot of times it just needs help, and in physical therapy that's what we do, is we facilitate the body healing itself. These structures that we mentioned previously tend to have little blood supply, and in order to heal, the body needs to draw blood to an area. So in physical therapy what we would do is teach you how to offload the mechanical stress on the structures and promote tissue healing so the body can heal itself and flush out the inflammation that's causing the pain. A lot of times if you let the pain go too long, it'll become to the point where you don't want to put weight on it or you can't walk, and then we have to do a lot more damage control than we needed to it if you came in when you first initially started feeling pain or tightness. We wouldn't want this to become a surgical situation, which sometimes it can be. So if you are having any knee pain, give us a call here at Loudon Sports Therapy Center or click the link below and we can assess your knee for you.